Hello, everyone. As parents, as teachers, it's a very big challenge when we realize that we have a child who is ADHD. I'm very sure, as teacher educators, in every class we come across, ADHD students, and we tend to, somehow we feel we are not really doing justice to them. So the intention of this video is to create an awareness for the teachers, the educators, the special educators, and the counselors, as well as the school leaders and everyone, to see that let us not ignore this aspect. So coming back to ADHD, when we talk about, I suddenly remembered Adam Levine, who is a songwriter, a singer, and he is an ADHD person. He thought that during his childhood days he had ADHD and he had to manage that. Thankfully, his parents were very supportive. He had the right treatment done, and he thought that with the proper intervention, timely intervention, the ADHD would be going off as he grew up. So he realized later that it hasn't gone. So that is what you can see. ADHD is for life. Um, my intention is not to discourage the parents or the teachers, but to help everyone to see that we can manage them effectively. So look at what Adam Levine is saying. He says that as I got older, I thought my ADHD had gone away. Eventually I realized it was something that was still there. So with this, let us understand that ADHD is not something which will go immediately, or which will, it may minimize to some extent with the help of proper treatment and intervention, but to get away from that, it's not that easy. Okay, so with that, let me continue my note. So here Adam Levine says that ADHD isn't a bad thing. You're not alone. If you have ADHD, says Maroon's 5's expressive frontman Adam Levine. He says that you're not alone. Even rock stars have to learn to harness their symptoms. So I have put what he has said about ADHD. He says that I struggled with ADHD throughout my life. It was a real struggling. It is not that easy. It was hard for me to sit down, to focus, and get schoolwork done. My parents were patient and helped me, along with my doctor, to move forward with a treatment plan that really worked. My struggles continued as an adult. I had trouble sometimes writing songs and recording in the studio. I couldn't always focus and complete everything I had to. I remember being in the studio once and having 30 ideas in my head, but I couldn't document any of them. So I went back to the doctor to discuss my symptoms, and I learned that I still had ADHD. It was affecting my career the way it had affected me in school. I got the word out that ADHD doesn't go in away when you grow older. If you were diagnosed with ADHD as a kid, you might still have it now. ADHD isn't a bad thing, and you shouldn't feel different from those without ADHD. This is the most striking line that I liked, and that's the reason why I selected today all about Adam Levine. He says that remember that you're not alone, and there are others going through the same thing. So, what I want my teachers to understand is that as a even parents also going through this phase, the stage of life where the parents are completely ignoring their personal life and now they're just looking into what best they can do for the children. I think this video will help you to understand much in a deeper manner, and it will help our children facing having the ADHD to face the life in a more meaningful and effective manner. So now let us first try to understand the behavioral challenges that an ADHD child goes through. First and foremost, they have a fear of failure. They are not very confident. They are very skeptical, quite apprehensive. So they have a fear of betrayal.
So that is the very reason why when you look at them, they look in a little puzzled manner. Next is they go through their childhood experiences are quite adverse, and then they go through medical conditions as well as they have the poor classroom management. They are not they're a bit disruptive in the class. Likewise, their communication or the speech or the language is not very clear. The communication disorders that you will find, you'll find the milestones delays, development delays will be there. Likewise, their academic achievement will be quite low. As teachers, please understand that the ADHD children, they want you to, they desire actually to be loved. They want their, them. They want you to understand them. They're basically, unfortunately, they are misunderstood by many of the teachers, even the parents. Sometimes I find maybe the mother understands, the father doesn't understand, or maybe the vice versa. Likewise, they are put to shame many a times. So it's very unfortunate that the ADG children are not well understood and well taken by the society. I'm sure that this video will help. It will be an eye opener for all the teachers, and it will help us to have a proper perspective towards the ADG children. Let us try to understand what exactly is attention deficit hyperactivity disorder. Now, ADHD is one of the most common childhood disorders. It can continue through adolescence and adulthood. And please understand the symptoms include difficulty staying focused and paying attention. You'll find these children are highly disruptive, the children are highly restless. You find them, difficulty, they themselves find a difficulty to control their behavior, and they're very, very overly active. Even though hyperactivity tends to improve as a child becomes a teen, but problems with inattention, disorganization, and poor impulse control, this often continue through the teen years, and also it goes into the adulthood. So ADHD is a disorder that makes it difficult for a person to pay attention and control impulsive behavior. He or she may also be restless and almost constantly active. So, as teacher educators, as teachers, as the special educators, counselors, and the school as a whole, please try to understand them that this is not the mistake of the child, but the child is having some kind of neurological disorders, and that's the reason why the child is going through this. Let us again understand that this ADHD is actually a neurological disorder that affects a person's ability to control their behavior and pay attention to tasks. So again, as I'm saying, these ADG children, please do not label them, do not target them, and it's only because of the neurological disorder that we find the children have difficulty to control their behavior, and also they are quite impulsive. Now, what causes ADHD is yet another point for us to ponder on, and please understand it has many causes, and among these causes are familial, that is family. ADHD often runs in families. Number two, due to abnormal brain development, and number three, brain injuries that occurs before, during, or after birth. So these are some of the causes that has been identified, and the reason for the children having ADHD. Now, why is ADHD considered as a neurological condition? Now, please understand the brain images of the children with ADHD. They may show differences compared to children without ADHD. For example, in some children with ADHD, certain parts of the brain are smaller or less active than the brains of children without ADHD. So these changes may be, linked to specific brain chemicals that are needed for tasks such as sustaining attention and regulating activity levels. So that is the reason why ADHD is considered as a this is considered as a neurological condition.
Also, teachers, please try to understand that ADHD is not just a childhood disorder. Although the symptoms of ADHD begins in childhood, ADHD can continue through adolescence and adulthood, which I already told you before. Even though hyperactivity tends to improve as a child becomes a teen, problems with inattention, disorganization, and poor impulse these control often continue through the teen years and into adulthood. This point has to be very well registered by all the teachers. Next is, what are some of the other conditions that are common in children with ADHD? Now, when we talk about other, conditions are like, these children with ADHD, they also may have learning disabilities or disorders of mood. They will have mood swings. They may sometimes be in a very good mood and suddenly they'll get angry. So and also sometimes they will go into depression, or maybe certain times they will go to into anxiety. So problems with planning, memory, schoolwork, motor skills, social skills, or control of emotions and response to discipline, these are all very common. And also unfortunately we also find that the sleep problems also can be more frequent for these kind of children. So let us further try to understand certain causes that I would like to highlight. What actually causes these ADHD? First and foremost, let us be very honest, it's quite genetic. And the other reason we found is that during pregnancy, there's a smoking, cigarette smoking, or alcohol use or drug use that can also have an impact on this. And sometimes, the environmental toxins such as high levels of lead at a young age can also cause, ADHD. Even premature kids, or maybe low birth weight, or maybe brain injuries, or combination of factors, all this can also be the cause for ADHD. Now, something very interesting that I want as teachers to note down is, understand that children with ADHD, they have to move to maintain alertness. You can't make them sit still or tell them to keep quiet and all this stuff. They have to move if you really wanted them to have alertness. And the message isn't like let them run around the room, but you need to be able to facilitate their movement so they can maintain the level of alertness necessary for cognitive activities. This has to be noted down. And people with ADHD may also have additional problems such as sleep and anxiety disorders, which I already told. Now, please understand that, why we aren't listening. The child, the inner voice of the child for you to hear. Okay, we are purposely ignoring you. We are so focused on something else we can't hear you at all. So think about what is the reason. It is not that they are purposely ignoring you, they are actually focusing on something else which you can't understand. So it's very little bit, you need to understand these are all small, small things which we have to pay attention to. Also, let me, explain to you, let us note down the differences between hyperactive kid and hyperactive children. So, when we think about those hyperactive children, they are fast moving, they're impulsive, whereas hypoactive children are slow moving, they are lethargic, and they are quite passive in nature. Here, hyperactive children, they lack inhibition, they lack self control, they are overactive. Whereas here, hyperactive children are sluggish thinkers. They are quite slow in their actions and all, and they have brain fog. Actually, they get easily confused, and they have poor concept of time. Coming back to hyperactive, they have impulsive thinking, they guessing, aware of everything around him, normal thinking, and they are distracted very fast. Words are too fast. They guess and they answer before the question is completed, and all those things. Whereas in hyperactive, we find that they're not sure what to pay attention to, and they pay attention to wrong things. They are not usually disruptive. They will be, you'll find them very quiet and very, very uh, very calm child, So, and also other thing what we have understood is that these hyperactive children mostly, we most often we find they are girls, okay? And likewise in hyperactive, you found their walks to be very fast, they are very impulsive, and these are the differences I would just request you all to keep in mind as we try to go deeper into understanding the concept of ADHD. Also, unfortunately, they are the children who are often called as they are the ones who wanders away. They are the spaced out children. They are the screamers, and all this kind of stuff that we tend to, we have an impression about these children as screamers and everything, very restless, very disturbing. So it's very unfortunate because we are not thinking deeply about what we are saying, what we are talking about. Now let's consider this. All children may be inactive, hyperactive, or impulsive sometimes, but children with ADHD, these behaviors are more severe and occurs more often. To be diagnosed with the disorder, a child must have symptoms for 6 or more months. Please understand, and to a degree that is greater than other children of the same age. So this is very important for you all to make a note. Now, when I talk about the diagnosis, which is very important, and as teachers, we should understand the fact that there are variety of behavioral assessments methods. Now, you can use the rating scales. You can, you have teacher rating scales, parent rating scales, and direct observation. So, based on all these things, you can, and then you can find in the Google, in the website, you just have to check like for corners rating scale. DSM-V is there, attention deficit disorder scale is there, behavior assessment symptom for children 2 to 3, that is also there. So now what do you mean by rating scales? These are the assessment measures which are based on reports of behavior observed by teachers and parents. One concern about the assessment of ADHD is the lack of consistent physical evidence to diagnose the condition. So I will tell you, give you an example, and I'll show you the, what exactly is this DSM-V file. Now I spoke about DSM-5. Now, what do you mean by DSM-5? It is a diagnostic and statistical manual of mental disorders. Okay, and the sources from American Psychiatric Association in 2013, they have brought out with this, and this is very helpful for the teachers in particular. So you have a checklist here, and please understand that the given criteria for inattention, hyperactivity, then impulsivity, or both, inattention for 17 and younger, please understand. And so what is important for the teachers to notice, 6 or more of these symptoms must be present for at least 6 months. And as a teacher, you should note that it should be consistent with the child's development level and have a negative effect on their, please note this, okay, this actually has a negative effect on the social and academic activities. So to be endorsed, the following must occur often. Okay, now what are those criteria or the parameters? So, like for example, the child is failing to pay close attention to details. He has trouble sustaining attention. He doesn't seem to listen when spoken directly. He fails to follow through on instructions, and he fails to finish his schoolwork or chores. He has trouble getting organized, avoids or dislikes doing things that require sustained focus or thinking, loves, he loses the things frequently. He will be getting easily distracted by other things. He forgets the things. So these are few, and few more I would like to talk about. So I would like to repeat again, you have to check whether these parameters or these criterias are found frequent, okay, often. Apart from the earlier points that I've told, understand that these are also yet under few more. The fidgeting happens, fidgets with hands or feet, or squirms in the chair. The frequently leaves the chair when seating is expected. You'll find them running or climbing excessively, trouble playing or engaging in activities quietly, acts on the go and as if driven by a motor. Likewise, you'll find them talking excessively, blurts out answers before questions are completed. They have trouble waiting or taking turns. They interrupt or intrude on what others are doing. Further, to understand the fact that ADHD has three subtypes. Now, when we talk about three subtypes, it means like, they are predominantly hyperactive, impulsive. They are predominantly inattentive. Or sometimes the third type is like combination of hyperactive and impulsive and inattentiveness. So most children have the combined type of ADHD. This also has to be noted down by the teachers. Further, talking about the symptoms of ADHD, kindly note that this must meet the following criteria too. Number one, when we talk about severity, the symptoms must be more frequent and severe than are typical of other children at similar developmental levels. Number two, early onset. At least some of the symptoms must have appeared before the child reaches age 7. Duration. The child's symptoms must have persisted for at least 6 months prior to the diagnosis. Now, teachers, let us try to understand the symptoms of inattention. Now, when we talk about inattention, they have trouble staying focused, is easily distracted, or gets bored with a task before it is completed. Okay, next is they appear not to listen when spoken to, and you get very, annoyed and all. They have difficulty remembering things and following instructions. They doesn't pay attention to details or makes careless mistakes. They have trouble staying organized, planning ahead, and finishing projects. Also, they frequently loses or misplaces their homework, books, toys, or other items. So please note down, these are the very important symptoms when we talk about the inattention. Now, talking about the symptoms of hyperactivity, number one, they're on the go. They fidget and squirm in their seats. They talk non-stop. They dash around, touching or playing with anything and everything in sight. They have trouble sitting still during dinner, school time, story time. They are constantly in motion. They have difficulty doing quiet tasks or activities. So these are very important points to be noted by the teachers in particular, and also by the parents. So the symptoms of hyperactivity. Talking about the symptoms of impulsivity, please understand that they act without thinking. They get their guesses rather than taking time to solve a problem, or blurts out answers in class without waiting to be called. Or you can hear, they hear before they hear the whole question, they will give the answer. They intrude on other people's conversation or games. They often interrupt others, saying the wrong things at the wrong time.
Also, the inability to keep powerful emotions in check. They have that inability, which results in angry outbursts or temper tantrum. So, in other words, let us understand that children with ADHD generally have deficits in executive function, the ability to think, plan ahead, organize, control, control impulses, and complete the task. Teachers need to take over as the executive, providing extra guidance while your child gradually acquires these executive skills of his or her own. Remember, teachers, all the children, all of them, all the children can learn. Let us not forget this. Now, let us understand how these ADHD is treated. Now, first and foremost thing, especially the preschoolers, the children of age between 4 to 5, when we talk about the ADHD treatment, please, as teachers, please be sure that they get what's best for them. And if you look at where have we been actually, almost 1 in 2 preschool children with ADHD actually got no behavioral therapy. About 1 in 4 were treated only with medication. So, such an unfortunate, very pathetic it is when you look at the surveys. And where we need to go now, we have to provide behavioral therapy first before medication. Let us not jump into by giving medication to the children. This is also very important point. And what can you do for that as parents and as healthcare professionals, as teachers, as please try to understand a lot of things are there. Now, currently available treatments focus on reducing the symptoms of ADHD and improve its functioning. Treatment includes actually medication, alternative therapies, then counseling, educating, combination of treatments. So, use of a multi-model plan of treatment that combines counseling, effective instruction, behavior management strategies, family and childhood counseling, good parenting, and home management is what is actually required. So, now the question is, what do I do? My movement should be stand close to an inattentive child and touch him or her on the shoulder. Okay. Number two, walk around the classroom as the lesson is progressing and tap the place in the child's book. This all can definitely help. So, what else do I do? So, as a teacher, my organization should be like you should have an assessment checklist for the teachers as a teacher that will help you to understand, okay, the students with ADHD. Keep the schedule. You need to schedule the breaks. You need to give a timeout, organize everyday items, be clear and consistent, and most importantly, give praise or rewards when rules are followed by them. Apart from that, you should also remember, like as a teacher, my reconnections. You should randomly pick the reciters so the children cannot time their attention. Use the child's name in a question or in the material being covered. Use a soft voice to give direction. Try to develop a private running joke between you and the child that can be invoked to re involve you with the child. Again, what do I do? What I do to my questions, very important, pause and create suspense by looking around before asking. Ask a simple question, not even related to the topic at hand, to a child whose attention is beginning to wander. You need to signal that someone is going to have to answer a question about what is being asked. Apart from this, again, what else can I do as a teacher? Think about your content, okay? Here, try to decrease the length of assignments. Try to alter physical and mental activities.
Increase the novelty of lessons. Try to have more of group work. Try to incorporate the children's interest into a lesson plan. Structure in some guided daydreaming at time. Unite, try to give some simple, concrete instructions once. Try to employ peers or older students or volunteer parents as tutors. Teachers, please remember that the ability to think and plan ahead, organize, control impulses, and complete tasks. Uh, for all these things, teachers need to take over as the executive, providing extra guidance while your child gradually acquires executive skills of his or her own. Now, for those adults having ADHD, please understand that if you find it hard to stay organized, then better to make a list, keep diaries, stick up reminders, and set aside some time to plan what you need to do. So, most importantly, if you really want to be organized, you need to have a proper planning. Next important thing is let off steam by exercising regularly. It can be going for a walk, joining a gym, going for swimming, anything of that what you feel is best to relieve your steam. Other important point is you need to find ways to help yourself relax, such as listening to music or learning some relaxation techniques. Now, if you have a job or you're doing some business, talking about a job that you're doing, okay, speak to your employer about your condition, but I don't know practically to what extent it helps. However, to some extent it helps, like, but not to go beyond a limit. Now, other important aspect, being an adult, you are more responsible and you do not have any that kind of support by the parents as they are old age, or maybe you cannot expect any mentors there. So better you talk to a professional doctor about your suitability to drive if your ADHD affects your driving also. Now contact, this is yet another very useful thing that we have found for the adults having ADHD is that join a local or national support group, any organization, so that you can be in touch with other people in a similar situation, and it can be a good source of support, information, and advice. Talking about different ways to cope up in general, okay, we're talking about. So most importantly, plan the day and set the routines. Try to set clear boundaries. Reinforce positive behavior with immediate praise or rewards. Be clear using enforceable consequences such as taking away a privilege. Be very positive and give specific praise, and give instructions, give very brief and specific instructions when you give an instruction to the children. And remember, try to involve your child in the incentive scheme. Allow them to help decide what the privileges will be. Let them have an understanding about that, and try to focus on just one or two behaviors at a time. Do not bring too many behaviors that will make the kids more chaotic. Other few ways to cope up in general, please understand, to intervene early. Distract your child if possible by taking them away from the stress situation which can calm them down. Don't try to keep them in that same aggressive situation if in case you find them very restless or very impulsive. Also try to keep social situations short and sweet. Do not keep them for long hours with the crowd because that will make the scene or the situation bad. Make sure your child gets lots of physical activity during the day. Very important. And don't keep them at home. We know, some of the parents after the grade 12th and all, the children are kept at home. They're given the videos, video games, or given the laptop or the mobile phones, and they're busy with that, or maybe they're just simply sitting and doing something. But physical activity is something which has to be kept in mind in a very serious manner. Also, keep an eye as a parent and as a teacher, keep an eye on what your child eats. I would request my teachers, because when you people tell that in the class, and also to in the counseling sessions or the orientation time, parents need to be given awareness on this. So even if you're a parent having an ADHD child, please keep an eye on what your child eats. If a child is hyperactive after eating certain foods which may contain additives or caffeine, keep a diary of these and discuss them with your GP, so that you'll get a proper direction or guidance on how to go about. Sleep problems and ADHD can be a vicious circle. Actually, ADHD can lead to sleep problems, which in turn can, make symptoms worse. Talking about the foods, these are the foods which have to be avoided. Attention deficit hyperactivity disorder, the ADHD foods to avoid. Number one starts with sugar. Avoid that, please, for that matter. Number two, gluten. Number three, conventional dairy products. Food coloring and dyes, that some of the items that we get, whether it is gulab jambul or maybe the laddus or maybe there's some sweets, please keep a check on that. Caffeine, and what about MSG, the monosodium, what is that called? Ajinomoto, and nitrites, artificial sweeteners, personal food sensitivities, as well as allergens. On all these things, as parents particularly, please keep an eye on that and have a check on this. Further, please remember that the child with ADHD who is ignoring you, annoying you, or embarrassing you is not acting willfully. He wants to sit quietly. He wants to be tidy. He want to be organized. He want to do everything that their parents or the teachers says to do. However, he doesn't know how to make these things happen. Please remember this. If you keep this in mind, it will be a lot easier to respond to your child in a positive and supportive manner. So, with patience, with compassion, and with plenty of support as a teacher, as a parent, we can help these children to do wonders. uh, how we often feel as the ADHD one, like the kid, the inner voice of the child with ADHD, it silently tells us that we are misunderstood, we are kept as a subordinate, we are made to feel ashamed, we are actually afraid to fail, we desire to be loved, we desire to be accepted for what and who we are. The question to all of us is that, are we understanding that voice? Are we listening to their inner voice? Are we making them feel that they are loved and respected? Think about it, introspect on this.